On the topic of fraud, how much money has the NDIA been able to claw back through identified NDI fraud?
Thanks, Senator. I'll ask Deputy CEO John Dardo, who leads that program, to come forward to the table.
Thanks for the question, Senator. There are different ways to measure that. One of the ways to measure is to think about how much we've prevented from going out the door by implementing systems or detecting the integrity leak before the money has left the door. Another way to measure it is to look at whether we've asked the participant or a provider to pay the money back. Another way to measure it is to measure it by the amount of money that is subject to a prosecution activity, so where it's gone to the courts. Not all of that is recoverable because unless there's criminal asset confiscation or unless there's penalties being charged, that money may not be recoverable. So there are lots of different ways to measure it. What I would say is that as my colleague mentioned earlier around detecting the anomalies, there are a range of things that we've been building up over the last 18 months to allow us to identify where there are integrity leaks. And what I would emphasise is integrity leaks are very, very strongly correlated to participant risk. The safety of participants is put at risk when money is leaking to the wrong places. It's because the participants aren't receiving the services they need, or because we've got providers that are dodgy, that are actually growing their businesses at the expense of good providers, so they're wiping out the good providers, or because that money is actually funding activity for participants that is putting them at further risk, whether it be drug abuse, alcohol abuse, risky behaviours or other behaviours. So the money is important, but the reason we look at the money is because of the participant safety impact that it has. What I would say is, there's a level of detail that I can't share in this forum. Happy to do it in a private setting, because we do not want to run a 101 session on how to commit fraud against the NDIA. But if I'm on the public record in previous hearings of talking about the layers of concern that we have. We have, round figures, over 600,000 participants in the scheme. The system is extraordinarily immature for a system that pays out, over $100 million a day, 400,000 claims a day. It is an extraordinarily immature system. Certainly one of the most immature I've seen. So if I think about the sorts of risks that we're managing and investing in, being confident that a participant is a real human being and should be, is in the scheme knowingly. Actually exists. That is an area of risk that we're, certainly unpacking, understanding and identifying things that need to be addressed.
Excuse me. Out of respect for the Chair wanting to conclude pretty soon, could you, on notice, take it to provide the figures around the categories of fraud that you mentioned earlier on, please? What money has been saved?
We can do that, Senator.
Because there are concerns with the NDIS. It was hastily brought to life. It was hastily implemented, and there are concerns with over-servicing, as you know. There are concerns with under-servicing, and there are concerns with fraud. So, and that's not necessarily a reflection on the people in the NDIA at the moment, but that's the reality. What is being, and if you could take it on notice, please, to answer, what is being done in relation to auditing service providers who are sucking the scheme dry through fraudulent claims for services overcharged or actually not even provided?
An enormous amount of activity. So some of that activity is some randomised integrity checks. So we've done tens of thousands of those to try and understand at a randomised level what we're seeing. And, the sorts of common things we're seeing are over-claiming, duplicate claims, claiming for services that never were provided, claiming for services that are not consistent with the plan. And again, if I think about some other risk points there, we have some particular cohorts where we have very significant concerns about the behaviour of the cohort. And when we cross-reference our data with other data, such as tax data, for example, we see that some of our providers are non-compliant with basic obligations in the Commonwealth. If they're non-compliant with their basic obligations in the Commonwealth, but they're managing money on behalf of participants or managing services on behalf of participants, we've got concerns. So, you know, we have several hundred providers where they're managing money on behalf of participants or managing services or managing other providers on behalf of participants, and yet they're not compliant with the most basic tax obligations. So we're cross-referencing data with other agencies. We have, you know, there's a task force that was established and commenced in November 2022. At the most egregious end of the offending, that task force has now 16 Commonwealth agencies working together to identify networks of providers or syndicates that are targeting the scheme. You may have seen in the media some, you know, coverage about the search warrants being executed, the prosecutions being conducted, passports being seized as part of bail conditions or surrendered as part of bail conditions. That work is continuing to ramp up. You know, we have over 100 investigations in the pipeline, and some of those, you know, some of those cases are very significant, both in dollar value participant numbers being affected, but also the egregious behaviour of those providers.
So there are a lot of costs involved, and some of them are in the 16 agencies that are working with you, and that they'll be hidden from the total cost.
No, those agencies were funded as part of that announcement. So that funding was $140 million over 4 years. So those agencies, as well as the NDIA, were funded as part of that Fraud Fusion Task Force, and they're working in partnership with us.
Okay, thank you.
Break there, but I'm happy to return to you after the break if you have further questions.